Silica awareness. Some information about silica. Silica is the common name for silicon dioxide. 18% of the Earth's crust is composed of silica. Concentrations range from 75% to 95%, depending on where. Crystalline silica occurs primarily as quartz. Other forms of crystalline silica include cristobalite and tridymite. In the workplace, the occupational hazard is when crystalline silica becomes airborne. This can be generated when mixing castable refractory, grinding and cutting finished shapes, tearing out refractory material, cleaning out, and sweeping. The health risk with silica is when it is inhaled into the lungs. Respirable silica dust less than 10 microns in diameter will reach your lungs. Overexposure to crystalline silica can overwhelm your body's natural ability to remove these particles. Overexposure to these small particles can do the most harm. The accumulation of dust in the lungs and the resulting tissue reaction to dust is called pneumoconiosis. The following dust can produce pneumoconiosis: grain, cotton, coal, cement, nickel dust, asbestos, and silica. Silica dust can aggravate upper respiratory conditions such as asthma or emphysema. Silicosis is the progressive buildup of scar tissue, which can result in reduced lung capacity, weakening of the lungs, or in extreme circumstances, death. Silicosis can occur in those exposed to silica dust in 5 years or sooner. Chronic silicosis usually takes 20 to 45 years to develop. Silicosis is non-reversible. Smoking can severely speed up the onset of lung disease related to silica exposure. It is also linked to chronic pulmonary disease such as bronchitis and tuberculosis. One form of crystalline silica, cristobalite, is of particular concern. There is sufficient evidence through data and experimentation to show that cristobalite silica is carcinogenic, or that it causes cancer. Being exposed to crystalline silica dust will develop into a syndrome called silicosis. Silicosis causes shortness of breath, a harsh cough, chest pains, fatigue, loss of appetite, and fever. The best method of accurately identifying silicosis is through medical examination, such as a chest X-ray or a lung function test. Your body does have a natural defense mechanism when it comes to the inhalation of dust. When dust is inhaled into the body, your respiratory tract tries to naturally push it out using the cilia hairs which line your respiratory system. That, along with the production of mucus, helps push out any respired contaminants out of the respiratory system. But the system is far from perfect and can be overwhelmed, so your best line of defense is through the use of respiratory protection. While your body does have these natural protective mechanisms, such as nasal hairs and the mucociliary escalator discussed on the previous slide, activities such as smoking decrease the effectiveness of these natural protective mechanisms. Further, particles smaller than 5 microns can penetrate deep into the lungs. The smaller these particles, the deeper the penetration. These are the particles that cause the most issues and can develop into silicosis and other lung disease. The smaller the particle, the more easily it will pass deep into the lungs. The further the particles you inhale travel into the respiratory tract, the more difficulty your body will have in removing them, and the greater the chance that exposure might develop into lung disease. Silica molecules fracture easily and continue to fracture when stress is applied during processes such as tear out, mixing, and grinding, causing respirable dust. Asbestos and silica are of particular concern when it comes to lung health because when inhaled deep into the lung's natural ability to destroy invading foreign matter is not effective on getting rid of silica or asbestos. Because silica of less than 5 microns can be inhaled deep into the lungs, this over time poses the threat of developing lung disease such as silicosis. This is why it is so important to ensure you have proper respiratory protection in place when dealing with silica. Silica is highly regulated in the workplace, and your occupational health and safety regulations will set out what your occupational exposure limits are when working with silica. While industrial hygiene testing can take place to determine what your workplace level of contamination is, best practice is to always use respiratory protection if you know that you might be exposed to silica dust. As with all workplace hazards, the hierarchy of controls should be employed to limit exposure to silica dust. Whenever possible, elimination or substitution should be considered. If not possible to eliminate or substitute the risk, engineering and administrative controls must be put into place to control the risk. Any residual risk should be controlled through the use of PPE, specifically respiratory protective equipment. Silica is highly regulated in the workplace, and your occupational health and safety regulations will set out what your occupational exposure limits are when working with silica. While industrial hygiene testing can take place to determine what your workplace level of contamination is, best practice is to always use respiratory protection if you know that you might be exposed to silica dust. Silicosis is preventable. Through good engineering controls and the proper use of PPE, you can effectively mitigate the hazard of silica dust exposure. You are ultimately responsible for your own immediate safety. If you're in doubt of anything, ask your supervisor.